Hello, I'm Robert, helping people scared of many things. And this is just something to give you a good heart. And this is I'm going to share the map of United States and look at the white areas. The white areas here, and I'll bring up the actual live map. And there it is. Then these white areas are ones that have had no cases in the previous day. No recent cases. Look there, that's Navajo County. So this was it's only recently turned white. Now sadly I don't have the previous map, and you can't get it in the Wayback Machine. It doesn't get saved to the Wayback Machine. The page does, but not this map. So what I thought I'd do is I'd just take my own backups every time it changes significantly. So that's the one as it is now, and then we'll see the counties very gradually go white, one at a time. And they're going that way and they're not going the other way. And look, for instance, Navajo County, and it'll maybe blip a little bit to a yellow again, but look at it, went up and up and up, and it's never gone down as fast as that. And it's gone from 1 in 1,000 to less than 1 in 100,000 since the beginning of January, 100-fold reduction. And this pattern is happening all over the United States. It's not just one county. If you go and look at here, then you can see, let's look at the infection rate. Yeah, so I'm just going to show you the metro areas, so that's quite striking, that the top 5 metro areas, if you look at the metro areas that are above 1, then there's 8 of them, and there's another 5 that are exactly 1. And that R0 above 1 means it's increasing cases per day. And that's out of, how many metro areas are there? I forget now. It was, I just made, I'll find it. Yes, that is the correct number. The 13 out of 384. So only 13 out of 384, all the others out of 384 are actually decreasing in cases per day. So that's very striking. Not just all the states are decreasing, with maybe some fluctuating just a little bit, but all the metro areas except 13 are decreasing. And an interesting little point I worked out, that it's something like about 2 million people in those 13 metro areas that are increasing. So about 2 million in the 8 that are increasing, then there's maybe another million in the other ones that are just staying steady. So if the vaccines stop transmission, and the experts I follow are pretty sure that they think it would be astonishing if it doesn't do at least some reduction of transmission, and you'd only need a 19% reduction, a 20% reduction in transmission to make all the top metro areas start going down instead of up, or a little bit more given that you don't vaccinate everyone. So if you've got, say, a 30% reduction in transmission or something like that, a third reduction or something, a quarter of it or whatever, then you would get the cases all going down everywhere, and you could vaccinate all those people in a couple of days, maybe even in a single day, most of them. 2 days to vaccinate them all. So as soon as we know that the vaccines do stop transmission, and the experts would be astonished if they don't, and they probably would stop at least half the transmission, that would turn 1.19 into 0.55, and that would be a very, very fast fall. So that's going to make a huge difference. Then if you look at the counties, and if you look at the cases per 100k, then there's some very high, there's some very, if you look at those, all the ones that are 0, they've had no cases. That means they've had no cases and all the top 100 have had no cases, no new cases in the previous day. But then if you look at the worst ones, then you have a few that are increasing rapidly, but a very small number. And that's just, look at the cases per 100, it's 0.0. So that means it's out of 2,000 people, you haven't even, that means you've only got, it's a little bit difficult to quite know how that works. 0.0 in 100,000 in daily new cases per 100,000, yet the infection rate of 3.75. So that seems a little bit strange. How can you have, let's look at Griggs County, I've got it up here. See, infection rate 3.71. I wonder even if it's a glitch in the, because it says it's got no cases. Maybe it's just a glitch in the maths, because that doesn't make sense. Because there are only 2,000 people, and you've got 0 cases per 100k. That's not consistent. Maybe they've done an accidental 0 divided by 0 or something. How strange. Anyway, so 3.7. Oh, I know. It'll be because the infection rate will have a bit of a lag in it. That'll be why. So the infection rate will be, that's quite a big lag. Must be a blip there somewhere. I don't understand that. Anyway, that's obviously, if you've got 0.0 there, you can basically ignore the infection rate, especially when it's only 2,000. So, but ignoring that one, if you look at the other ones, then those ones are then most of those, all those ones, the 2 that would not be reduced below 1 with a 50% effective vaccine at stopping transmission, all the rest would. And the top 100 would take you all the way down to 1.09. So if you had a 50% effective vaccine at stopping transmission, you could stop, and that's about 1 million people, I reckon. So that would be another day's worth of vaccinations, could stop the cases rising in all the counties with the worst, highest rising cases. So my point here is that once we start using vaccines to stop transmission, then we can turn the cases per day from rising to falling throughout the United States with just a few days' worth of vaccinations. We don't need to vaccinate 70%. Just indeed 1% of the US population vaccinated could turn all the metro areas and the 100 worst counties to falling from rising. It would take effect about 10 days later. And then if you did that just from time to time, every 2 weeks, you were to vaccinate all the worst areas to stop the transmission, to make it go down the other way, then we could have the cases going down uniformly across the entire United States within a month. And so I don't think people have really thought through or talked much. I haven't said, do correct me if people have been talking about this. So we've got lots of things in our favour. Look, I've commented before about how it's going down very, very straight, like that. And that means that it's not an exponential, which would be a curve. And that means that as it goes down, whatever they're doing is becoming more and more effective. And it could possibly be the vaccines just beginning to kick in by now. But probably it's things like the same public health measures, but with fewer people needing to be targeted, especially for things like contact tracing and for isolation, and being able to get to people very early and explain to them properly about why they need to isolate, and the people not being rushed and having plenty of time for their job, and just all the measures, just being better able to do everything, the testing, a faster turnaround of testing. Anyway, whatever the reason, I'm just guessing, I don't know, I haven't seen anyone really explain this yet. The World Health Organization says public health measures, but they haven't really said anything more detailed than that as to what public health measures specifically are the ones that are bringing it down so fast. Now, I was just going to mention one thing about the new variants. again, the experts I follow on Twitter, one of them shared this paper which had a very interesting, so the interesting thing is that the new variants seem to be as easy to control as the old ones. So how can that be if there seems pretty good evidence that they are actually more transmissible, and yet they are as easy to control, maybe even easier to control? And one possible explanation, and it's not the whole picture, because they do get into cells more easily, but these new variants in terms of the number of the viral load, you are less infectious, slightly less infectious, but for a longer period of time. That seems to be the situation. So if that is it, then the fast transmission would be mainly amongst people who don't isolate once they first show symptoms of COVID. And so long as you do isolate, your risk might even be less than it was with the old variants. But it's spreading very fast amongst people who don't isolate and don't do anything to protect other people when they get COVID. So that could possibly explain the pattern we're seeing of this very, very dramatic change. If it was going, we've got this, because it's the same in the United Kingdom, and it's the same in South Africa, you get a very rapid change around. And if it's more transmissible, how could it be that it changes so very, very fast from going up to going down? And I think maybe the new variants are more transmissible only in situations where people are very careless about public health. And they may be even less transmissible than the previous variants if people are careful about public health. Those two things are not inconsistent with each other. And there could be other ways that you could do it, but certainly, but the way that isolating, even if you, the isolating thing I just explained, is one way that could happen. Anyway, certainly the new variants are being controlled. And so then I just expect this map to be gradually, what else do I need to look at now? And so I've explained it's not too surprising, all the states are going down, given that just about all the metro areas are, some have little blips up, but just very, very, then they go down again. And so that's why I think that the United States may end up with zero COVID sooner than they expect. Because, first of all, there's going to be a big hit. There's going to be the vaccines also. They're going to start having an effect. A big hit on the number of cases and a big hit on the deaths once it's got time to percolate through. Hospitalizations and the deaths on top of what they're already doing. And then in the middle of March, you've got you've got the America Rescue Plan, and that's going to bring in 100,000 new contact tracers, which, when you've got 100,000 cases a day, 100,000 new contact tracers are not going to do very much, because you need several contact tracers for each person to do very effective contact tracing. But with 100,000 contact tracers, and then if you got it reduced maybe to say 50,000, and then you get it reduced again by the vaccine to say 10,000, or even less, to 5,000, you've got 100,000 contact tracers. I think that's about the right ratio. And there are the contact tracers that many states have already. So the 100,000 may even be more than they need. So by the middle of March, you've got this $350 billion of funding to stop COVID, plus another $35 billion for another project also to do with stopping funding COVID. And this is sure to pass. There's no way that Biden is not going to do that. And he has got the ability, if necessary, to use this reconciliation process to do that. Then, so I expect a really very rapid fall in March, April, far faster than they're predicting. Because of, I'm just looking at it in a slightly different way. So as a mathematician, the kind of mathematical intuition, for what it's worth, is that it's going to drop very fast. And because I think that by mid-March, there'll be many of the counties will be white, and they don't need to be vaccinated if they're white already. and they already are being vaccinated, but they don't need to go up to 70% vaccination. And there'll be many metro areas that are rapidly reducing, and then they will know that the vaccine stops transmission, which is very much suspected now already, and there's early results from AstraZeneca which strongly suggest that it's over 50% effective at stopping transmission, but maybe even a lot more if asymptomatic cases significantly reduce transmission, which seems quite likely. So by the mid of March or April, I expect most of this map to be white, and that because and without having to vaccinate 70%, they will just have to vaccinate the worst affected areas. And this is true the worldwide. So the COVAX Alliance is going to bring 27% of vaccines throughout the world. But if it's combined with public health, and that 27% of vaccine is enough to turn it around, so that, and if it's targeted and if it stops transmission, and they stop transmission in the worst outbreaks, and then they keep on doing that whenever there's an outbreak, then I think that it's possible that most of the world could be stopped. And especially, I mean, suppose that the United States goes COVID-free. And I think that's going to happen, at least with some states. So even if the federal government doesn't, then Hawaii is a natural one to follow the example of New Zealand and to go zero, COVID zero. And next up, that might be New Mexico, because New Mexico already has quarantine to all the other states, apart from Hawaii, where it's recommended. It's compulsory to, if you're going into New Mexico from any other state. And if they keep up those measures when they reach zero COVID, when they go to 0 cases per day in New Mexico, which they might even do as, maybe sometimes May, June or something, when the first states go to 0 COVID, then they will want to keep it that way, and they're likely to keep up their quarantine, and then develop travel corridors to the other states that are 0 COVID, like Hawaii. And then eventually there'll be some other state, maybe Texas goes 0, who knows. And so I think we're going to end up with a situation, so you've got New Mexico, and what's next to New Mexico? Does Texas border on New Mexico? I'm not sure. New Mexico. Yes, it does. So, yeah, so I mean, it'd be really quite dramatic if Texas went 0 COVID. But if it did, then you can imagine that New Mexico and Texas forming a corridor together. It's not impossible. In fact, if you look at it, there's lots of white areas also. There's lots of white cases all the way up to North Dakota. You could even have a 0 COVID central band if they were all to go 0 COVID, and then Hawaii and New Mexico. You could get a band like that. I mean, it almost looks like that might be what's going to happen. That the middle of the the middle of the United States were the last two, the mid, whatever you call it, Midwest, I forget the terminology, but these were the worst hit. These were the very last hit, and then the quickest over it. So they might be the quickest over it, and so they might go 0 COVID with the as a result of everything they're doing, and then they could have quarantine with the rest of the United States, and you'd have a 0 COVID strip. So I'm not sure, but I think it's a very natural thing to do. So I was just going to explain why I think. So you hear people experts saying, and indeed the majority of experts say that 0 COVID is impossible, and yet you get others that are just as certain that 0 COVID is what we're going to end up with. And they're in the minority at the moment. But first of all, what not many people know is that the World Health Organization was saying 0 COVID all the way through to mid-March, early March. By the 11th of March was when it stopped. And this was reported by the journalists as the World Health Organization refused to call it a pandemic. But what they were actually saying, they didn't have the word zero COVID, they were saying this is the first pandemic we can control, so we don't want to call it a pandemic because people will stop trying. And it's just lots of epidemics, all of which can be controlled. So they were saying that we can go for zero COVID all the way through to 11th of March. And then after the lockdown started, they then said once more, we could go for zero COVID, a precious second window of opportunity. Try searching the World Health Organization.in for window of opportunity plus COVID or coronavirus, and you'll find that, and last year, and you'll find loads and loads of press briefings. Just every press briefing they were saying that. And now what the World Health Organization say is, let's just see, let's go, it doesn't make sense to let the cases go up high, stay up high, because of the new variants that are going to get lots and lots of those arise. And once you're vaccinated, you've got to continue to be careful. Lots of people have got that message. And they're saying that we've got to go all the way down to just a few cases per million and then see. So, and then at that point, decide whether we're going to go for the moonshot of zero cases. Now, I'm trained as a mathematician, not as an epidemiologist or anything like that. But I have my mathematical way of looking at it maybe gives a slightly different insight. And so the way I see it, first of all, if you go down to a few cases per million, this is not like flu. It's not like flu in summer. This is not going down because of the season, because it was rising rapidly in March last year. So it's obviously not going down because of the season. And it's going down because of the public health measures. And the way I see it is that once you're down to 1 case per million, you have basically two choices. You keep it going down, or you let it go up again. It is almost impossible. It's not going to achieve natural herd immunity, obviously. It's not going to just simmer away because it's the summer. So once you're down to 1 or 2 cases per million, either you keep the R naught less than 1, and then soon you reach zero COVID, or you let the R naught go up above 1, in which case it'll zigzag, it'll start rising. Then at a certain point you say, oh, it's risen too far, and you'll have to reimpose some of the measures again. And that is basically what Europe has done, and the United States has done. They've zigzagged. Whenever it goes down to a few cases per million, they say, okay, we can't achieve zero COVID, so we'll let it rise again. And then once it's risen, then they'll say, oh, it's too high, we'll have to reduce it. And when it goes down to a few cases per million, they say, okay, we can't achieve zero COVID. We're down to one case per million, but we can't go all the way down to zero, so we'll let it rise again. And so it's a self-fulfilling thing, where because you keep saying you can't reach zero COVID, then you're just going to keep on zigzagging back and forth. And there's no stable point here, because it'd be almost impossible to keep it at exactly 1, R naught of 1, by using public health measures or by using a vaccine. Now, we have a very strong motivation not to let it go up and up and up, even if you've got a vaccine, because that encourages variants. So, really, I think countries are going to, if they're sensible, if they're at all sensible, not even thinking about zero COVID, not trying to achieve zero COVID, just keeping the cases below a few cases per million, and not zigzagging. And several countries have said they don't. United Kingdom has said we're not going to go into another lockdown. If that is what they're saying, if that's what we're going to do in the United Kingdom, the same in the United States. There's this sort of attitude that we're tired of it all. We've got to keep it going down and down. Then eventually you're going to reach zero COVID. There's no mathematical other possibility. Either you do it just by vaccination because the vaccine is good enough to achieve zero COVID, or by a combination of some public health measures. But the way it's going to go on the way to zero COVID is going to be like Australia and New Zealand. It's just lots of outbreaks with lots of regions with nothing. And those can let up completely. So when you're talking about public health measures, you go from public health measures everywhere to public health measures patchy. You only need to wear a mask. So say that was the last. Let's just guess, and it's not at all likely that I'll get it right. If that's a rather few cases per day, that's a very unlikely one. But 98 per, that's 98 per 100, 7.7 daily cases now. I need to find a bigger area that's got lots of cases per day, but I don't know if I can find one quickly enough. That's 67 cases per day. I suppose it's that one, but it's not rising. Let's stick with that. I'm trying to find a rising cases per day with lots of people. It's not very easy to find. Anyway, let's just take that one as an example. And just suppose that we had an outbreak like that, and that was just the only red spot in the map in that entire part of the area. Then you, as I just suggest, you go in, you vaccinate everyone if they haven't been vaccinated yet. They wear masks in that region. They you close down the hospitality sector a bit if you have to. You introduce physical distancing, but the rest of the country doesn't need to do anything. It'd be very much like what's happening in Australia. You have very sharp, short lockdowns, very localised, last a couple of weeks, and they're localised to a particular city or a particular county. So that could well be where we end up in the summer. And then if we do that, then we'd quickly reach zero COVID, just like with Australia. And Australia has lots of infections from the rest of the world because there's huge outbreaks happening around the world outside Australia, so they have to quarantine everyone coming in. But eventually, if we get the zero COVID corridor all the way up there, and then more states joining, maybe eventually the entire United States is zero COVID, and then they could join a travel bubble with Australia and New Zealand. I expect United Kingdom to be rather late to the scene on this, but I find it difficult to see how anything else can happen, except for one possibility, which is that COVID becomes tamed so much that it's just like a cold with therapeutics and the vaccine. And so when we get down to almost no cases in the summer, and people say, okay, we'll just let it rise and rise and rise and everyone can be infected. So basically, if it's the summer or whenever it is that happens, it doesn't need to be summer, it's not seasonal, not really. You can get outbreaks rising up any time of the year. But if say it was a few cases per million in the summer, I see these things. We have the zigzag, which just doesn't make sense at all, and people are fed up of going zigzags. And then we have the going down to zero COVID faster than New Zealand did because we've got the vaccine to help. And we've got much more knowledge and understanding, and we've got lots of things to put at it, and we'd have all the resources that we built up during the pandemic to focus on the few areas where there still are cases. We've got things like rapid testing, for instance, as well, which is a new thing, where you can just test everyone. So you could test everyone in that county, say it was that county, Kane County in Utah, then you've got so many things you can put into there to stop it very quickly. You can test everyone, and if you're at that point where they're the only ones left in the whole United States, you can test them all with PCR tests and get turned around in 4 hours. And then anyone who's got it asymptomatic or symptomatic, you isolate them. So we would have the resources by then to do stuff like that. Not even needing to do the antigen tests, but just go straight in with the PCR tests, because we've got enough PCR tests to do far, far more than that. Just retain that capacity, and so we can just test everyone, like they've been doing in Iceland, and like they did in one of these in a city in Italy a while back, Uggiano or something, I can't forget his name. So we can do that as well. So we can do the testing everyone, and then you don't even need to do contact tracing, because you test everyone every day. If you've got that many tests in surplus, you're only down to one small area. You can have contact tracers for everyone. You can, and it would be like in New Zealand, where you would have complete gene sequencing of every case, and so you could very easily work out the clusters and the connections between the cases as well. So the this is, I would be very surprised if we are still having problems next fall myself. And the way the COVAX is working as well, we are, and this also, so COVAX has catered for 27%, but if we don't need to vaccinate 70%, this is old thinking, this is vaccine only thinking. But given that public health measures also work for this disease, then no country needs to vaccinate such vast numbers. Vaccinate all the ones that are vulnerable and then bring down your cases very fast. And even with the, we're going to have a huge surplus of vaccines if we don't need the booster doses and things, then we've got enough for 60% of the population of the earth already. And if you don't need to vaccinate everyone, then you can achieve zero COVID with much less than 60%. So I think the United States might well achieve zero COVID with less than half vaccinated, maybe even just a quarter vaccinated, and have hardly any cases left. Because I don't know if it's because it's a very strange disease, but it does seem to work like that it is very, very patchy. And like in the United Kingdom, in the summer, there was almost no cases in the entirety of England, except the city of Leicester and an outbreak in a meatpacking factory. And if we'd gone in really hard at that point, we could have eliminated it from England. In Scotland, there was some cases in Glasgow and some cases in Aberdeen, and there were some cases in some schools. Among some school children who had been holding parties and travelling vast distances to meet up with each other when they shouldn't have. I think there were about three clusters in the United States, and the other two were due to some rugby players who again broke the rules. And they were from Glasgow and they travelled to Aberdeen. And so that set up two clusters, and then there was another cluster from some school children. I think that was basically all there was left in Scotland last summer. And it all just started rising again from that. And if we'd gone in really, really hard on those last three clusters, then we could have gone zero COVID in Scotland. And we could have gone zero COVID in England. And the reason we didn't was basically because people were tired of the lockdown. And there was a lot of political pressure to lift the lockdown. But if we'd kept up lockdown for another couple of months, or just a month even, then we'd have got rid of COVID. And if we'd also been willing to do a quarantine as well, a travel ban, which would be again politically difficult, because people wanted to go off and go on holiday in Spain, and so it would be again very politically difficult not to, at that time last summer, to stop people's holidays in Spain, which is then one of the main things that caused the pandemic to rise again in the autumn, along with opening schools too soon and without the right precautions. So we've learned from those mistakes, and I think we've got to be much more careful at this time. And once we got down to such few cases, now we've got the vaccine, now we've got also the possibility of rapid testing over an entire population, including asymptomatic. And the United Kingdom is already doing that. It's tried testing. I think it tried Leicester and tested some city about that size. They tested everyone in the city. Symptomatic or asymptomatic who wanted to be tested. So there are so many things we can do. Personally, I'd be very surprised if we don't see large areas go zero COVID rather faster than people expected, assuming that the vaccines do reduce transmission, which I think I'd be very surprised if they don't reduce transmission significantly, and especially if they reduce it at least 50%, and I expect they will. So, I mean, it could be that prediction is not true, but that's just my best guess based on reading what the experts say, and just and basically the rest is just basic maths, and just thinking like a mathematician. Then I just not as a modeler, just basic maths, very simple maths. So, but we'll just have to see what happens. But what I'm sure of is that it's going to get much better, but we do have to keep up with everything. We shouldn't. The World Health Organization have stressed this over and over again. the United States is definitely going to keep up. They follow the science very well. And luckily, the United States is very influential in the rest of the world. So I think it's going to happen throughout the world, that most countries are going to be following the science eventually, especially when they see how successful the United States is going to be. So this is very early days. You could come back and shout at me in 4 weeks, in 2 months' time, and tell me I was all wrong. But I don't think I'm going to be wrong. We'll just see. Anyway, I'll upload this, and so that's why I've started doing these maps. I think it's going to really lift everyone's hearts a bit, of the people lift their spirits. I mean, a bit of the people that I help, as they see the United States, which was one of the worst hit areas, gradually going white and free of COVID, first for a day at a time in different areas, and then eventually maybe entire states go zero COVID. So anyway, my personal opinion, based on reading, and the thing is, the experts who say it's going to go zero COVID, they make a lot of sense to me. The experts who say it won't go zero COVID, then they don't address the things that the experts who say it will go zero COVID say are the reason it will go zero COVID. And in a situation like that, then you listen, as someone who's not involved and hasn't got any skin in it, as it were, then I listen to the ones who answer all the questions, and who answer all the points for their point of view, and the ones who ignore the reasons that the others give for saying they'll go to zero COVID. So in that situation, I tend to go for the experts that are answering everything. And so I think we're going to go for zero COVID. I think we're going to reach zero COVID. Even though they're the minority of the experts, but personally, I think their reasoning is more cogent, is more compelling for someone who is basically not expert, not involved in any of this, and reading is the third person. Anyway, we'll see. We'll see what happens now. Now I'll upload this.